So, welcome to Love Heals Cancer in ZenOnco.io. I'm Astha from ZenOnco.io. This is our Cancer Healing Journey Talks, where we invite speakers who have gone through cancer, maybe as a patient, caregiver, or survivor. These CHJs are very close to our hearts because many patients tell us that when they listen to other people's journeys, it inspires them, it helps them boost their confidence, and it gives them hope that if others have been able to successfully beat the disease and take out inspiration and motivation, then why can't they? So thank you so much for joining us today for the Cancer Healing Journey Talks. Could you please introduce yourself and tell us how it all began and how did
Definitely. Thank you, Asta. Thank you for having me. It all began in 2019. So I have to actually take a few steps back before the beginning, like a prelude. So what happened was I've been fairly successful in my career. I come from a family which is pretty well known in Maharashtra. So there has always been a feeling of entitlement, so to say. And also the fact that I was always an average student, but I kind of did very well in my professional career. Uh, 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 that I always had a behavior pattern of focusing on something and getting into deep into it. So that kind of helped me in my career and also in my cancer journey. One of the things that happened is in 2019. I was actually shaving and I was bare chested. And when I was shaving, I noticed a small lump on my chest, on the right side of my chest, and found that suspicious. So I went and got myself checked. When we checked it, we did the ultrasound and then eventually a biopsy, and then the doctor said it's confirmed for it's cancerous. So that kind of shattered the world around me. That first diagnosis is really very scary for someone to go through. I uh, I can't tell you. I'm sure our viewers who would be going through this session, they would probably recall their own diagnoses. And trust me, it's a very tough thing to hear from a doctor. Uh, so after I heard that, obviously I kind of started thinking what should I be doing. I initially got very worked up. Then I told my wife about it. My wife was in India, I was in the US that time. And she was also concerned and worried. So this was in March 2019. Subsequently, I was told that I would have to undergo a surgery. Now, as you would know, right, whenever somebody hears the word cancer, the first thought is, okay, I got to go to the best doctor I can and then get the best treatment, and then they are going to guide me, and I'll do whatever it takes to get rid of it. That's the same way I thought about it. And I went with a lot of questions. Why did this happen to me? I asked the doctor. Doctor didn't have an answer for me at that point of time. And obviously, there are so many cases they would not know. Science has not progressed to a point where they can tell you the cause of cancer, very honestly. But in the whole process, I was able to figure out my own reasons and causes for my cancer. And I kind of have figured that there are common causes. As I speak to more and more cancer patients, I see a pattern, and we'll talk about that pattern also when we get to the session. So anyway, at that point of time, I went to the doctor. Doctor said you got to get an surgery done, a mastectomy. It was termed as stage 2 male breast cancer. I went ahead and got the surgery done. And then subsequently, the next year, it came back again in the form of a small cyst around that surgical area. So I did another partial mastectomy. So there were 2 surgeries I underwent. And as a precautionary measure, the doctor asked me to undergo radiation therapy. So I went through radiation therapy as well. That was in 2020. So 2020 May was the time I got my second surgery, and my radiation happened in July-August timeframe. Again, I went back to my old lifestyle, and my lifestyle was very toxic, by the way. So I used to not sleep well. I used to exercise heavily. I used to drink a lot. I was a smoker, but I had stopped smoking after my diagnosis. But still, I used to eat pretty much anything and everything. I had no sense of a balanced lifestyle, so to say. So and my way of thinking was, okay, I've got this cancer. I got to take my body to the doctor, just like your car breaks down, you take it to a mechanic. So let me take myself to the doctor. He'll fix me up, and then I go back to my ways of life. That's what I was doing. So after the radiation, I did the same thing. And in March 2021, I had severe pleural effusion. Water started building up in my lungs. Uh, I I couldn't breathe, so I couldn't even walk a couple of steps. I had to take a break every time I tried to walk, and my breathing was completely impacted. I was very uncomfortable. I went to the doctor, and she said, "Pravin, get yourself admitted right away in the hospital. Your lung has collapsed." I went to the ER somehow and then got myself admitted. They did out 5 liters of fluid from my right pleura. And then they tested it. They found that my cancer had metastasized into my esophagus, my lungs, my thorax, bones, lymph nodes, you name it. It was all over the abdomen region. So it was stage 4. The prognosis was very bleak. Doctor told my wife, he probably, 3 months, 6 months, he will probably not live longer than that. I went back, I was very shattered, and that was the whole story. That was before I started making the changes that I did in my lifestyle.
Right, sir. So first of all, of course, as you said, that it is actually shattering, whenever we like hear the word cancer, of course, it is very much shattering. So, like, I wanted to ask, like, apart from the medical treatment, the conventional treatment, what all other treatments did you try? Any alternative therapy, any complementary therapy?
Yeah. So what happened was I went to the doctor, and again this time I went a bit cautiously because I had been going to the doctor earlier also, but the first thing I did was, once I got to know what my doctor had decided, kind of mentioned that you'd probably not live more than 3 to 6 months. I said, first thing is to change my doctor, because the doctor who doesn't believe in me, in my chances, then it'll how do I fight, something like this without a doctor who believes in curing me, right? So I changed my entire care team. I went to Memorial Sloan Catering, which is one of the top world's topmost. I happen to be staying close to where that is. So right now I'm in India tending to my mom, but in the US I stay in New Jersey, which is very close to New York, which is where Memorial Sloan Catering is at. So what I did was, the doctor asked me to undergo, some tests, and one of the tests was a genetic test. In the genetic test, we found out that I had done this similar test in 2019 also, but I was not able to find any mutations. This time round, I was able to they were able to identify the mutation to be something called as PIK3CA. And when they found the mutation, she started saying that, it may be a good idea to get enrolled in a clinical trial which is targeted at this particular mutation. And while she was searching for the trial, I didn't this time, rely on just the doctor. I started, started initially Googling, like all of us do, and then I started reading books and stuff, and there's a whole story to it, and we'll cover it in the session. But what happened was, I was all kind of down and out. I used to cry. I used to tell my wife that it's all over. And my wife one day, she told me, Pravin, what are you doing? I mean, if you're alive, sitting here, breathing, that means there is some higher purpose. So stop, giving up. Uh, if God wanted you dead, then you bus would have come and hit you, right? You're still alive, breathing, everything's fine. So don't give up so easily. And I don't know, that kind of made sense to me, but I didn't know what to do. It kind of motivated me. The next day, one of my friends and neighbors, he came in and gave me a book on alternative medication, on natural therapies. They had like 400 different techniques which one can try for cancer. And obviously that got me thinking. So I started reading the book, and as I started reading, I started getting ideas. As I started getting ideas, I started experimenting with myself. And then slowly, I formulated a protocol for myself, which was very natural. And I was doing it in parallel with my allopathic, treatment. And what I noticed was there was especially a tipping point, rather. My doctor told me that, Praveen, we found this amazing clinical trial drug. We're getting some good results, but for me to enroll you in it, I have to get you off all medication for next 5 weeks, because they wanted to see the progression of cancer. And for that, she asked me to go off all medications before they put me on a trial. Now, the only thing I was doing at that time was experimenting with myself, with natural foods and, natural herbs and diets and lifestyle changes and all that. So I said, okay, fine. And so for 5 weeks, they did a PET scan before and they did a PET scan after. And the only thing I had changed was my lifestyle. And I was taking no medication. And then after the 5 weeks, I got a call from the doctor's office saying that, Mr. Khatal, and there were a lot of missed calls, like 25 missed calls. And I was like, what's going on? I saw that and I got scared. I said, what's going on? And she said, Mr. Khatal, we've been trying to reach you. What have you been doing? And I got scared. I said, what do you mean, I have been doing? She said, no, your results are amazing. Your cancer tumors have gone down by 50%. Your cancer tumor markers have come down by half. And what are you doing? It's amazing. And I told her that I'm doing this diet, and she said, no, that is fine. Have you been taking something? I said, no, I'm not taking anything except I'm just doing this diet. And she said, oh, I don't think that's the case, in any case. So that's how but I was convinced that I was the only thing I was doing was the diet, and at that point of time. And then I realized maybe the natural diet is working. So then I started focusing on that. And then I started saying, okay, what are the other natural things that I can do? So I kept, asking, I keep on asking this question even today, to myself, saying that, hey, what else can I do? And then in the whole process, I figured out, certain yogic techniques which help you, build immunity. There are certain pranayams, which help you build your immunity. There are certain things that you can do, with regards to your mental chatter. There are certain things that you can do to improve your digestion process. There are certain linkages with your CBC counts and what you eat. So I started realizing those connections, and I made some changes, and I started seeing some results around that as well. So and then it came to a point where in 2022 February, my doctor said, Pravin, I don't see any traces of cancer anymore. You seem to be perfectly fine. All my results and everything kind of showed that my tumor markers were all in the normal range. My CT scans kind of pretty much showed all clear. There were some spots there, but nothing serious, those kind of things. So that's the story. And I continue to do this. I continue to, maintain that lifestyle, uh, you know, and that helps.
Right, sir. So I think the thing that you just told, it was so much inspirational. I think I just totally agree with you. Like no matter what treatment we take, if our body won't be that much healthy from the inside, if we don't have that much immunity, that much strength in our body to, actually tolerate the actions that we are taking, so then it's of no use. So actually the natural therapies, and in fact the diet, the most basic and the most natural thing that we can take care of. So it's really nice to hear from you that it helped you so much, the diet, the natural other things, the ayurvedic herbs and natural supplements that helped you so much. So I'm glad to learn about that. And so like
Yeah.
I wanted to ask, like what
By the
message.
way,
Yeah.
I did not take any Ayurvedic herbal supplements. I did not take any natural supplements. The only thing I was putting into my body was uh, pure food, organic food,
Oh,
uh,
okay. Right, right.
vegetable. only vegetables. I was not even having fruits because I was worried that fruits may have fructose in it, which may feed the cancer cells. But subsequently, I have discovered that fruits are good for you and you can have them. So I have started having fruits. I recommend that people who are undergoing treatment should have fruits. But at my time, I didn't, because I was kind of shooting in the dark, right? I was trying to figure things out of myself, and that time I didn't. The only thing I used to drink was water, nothing else, only water. Sometimes green tea, and the only thing that I used to, I had made a protocol that I have to do pranayams every day, I have to meditate every day, and I have to do yoga every day. And the entire protocol of my pranayam, meditation, yoga, and I also started walking. Eventually, I started running. These days, I run 5 kilometers every day, 4 times a week, a minimum. And today also I ran. It was a 5 mile walk and run. Walking was the rest of the piece, and 5 kilometers was running. So
Yeah, so that's good to know. In fact, mental and emotional wellness plays a very important role, during the treatment and even after the treatment. It is so much important to, just, to be positive, to be hopeful. So it is very important. And, I'm so happy to know that not even the supplements and all, but just managed everything through the natural diet, like as natural as. So that's
yes,
really good to hear.
I was doing a lot of fasting though. I'll tell you, I fasted a lot, a lot of natural diet. And then one of the things that I was doing was I I had formed a protocol. I had created a text for myself because I knew if I had to overcome this, I had to brainwash myself into believing that I'm going to get cured. So I had formed a text for myself, which I used to read every day in, day out, and the text was actually just saying that, you know what, Praveen, you are every breath you are taking, the cancer cells are reducing in your body. You are becoming more and more fitter, finer, uh, you are going to live till, you see your grandchildren and all those things. Basically, all the things that will keep you motivated. So a lot of that actually helped because I know finally you can do all the diets in the world, you can do all the exercises in the world, but if you believe you are not going to live and you are going to succumb to that disease, you will. But if you believe you're not, you that disease is not going to harm, you cannot let it allow to harm. And more than anything, you should be in a comfort zone where you start believing that I'm already healing, I'm already healed. That actually plays an important role because you're in a way kind of programming your body to believe that you are healing. So that played a major role, I believe, to a large extent. I keep telling myself even every day today also, I have now the text is not that long, it is a few couple of statements, but I have to say them to myself every day.
Yeah, I think, affirmations work a lot.
Yeah,
Positivity, manifestations work a lot. Yeah. So,
absolutely.
right. So I wanted to ask, like, what message would you like to give to cancer patients as well as cancer caregivers?
One of the things caregivers, my heart goes out to them. They put so much of effort, and many times they go unnoticed, I would say. Along with the patient, the cancer, the caregivers need to be also taken care of. It is very important that they are, they get the right amount of rest, they get the right amount of information, they are strong so that they can support the patient. So that is one. And my message to them is, don't neglect yourself when you're taking care of a patient. That is one of the most important things they should be doing. And then the second thing for the patient themselves, I would say that unless you are breathing, as long as you're breathing, you cannot give up. Your life is not so cheap. Please don't give up. Till the time you're breathing, always a fighting chance. Think about all that you can do. What else can I do? ask yourself this question, what else can I do? And love yourself, because I actually was reading this somewhere, and a lot of people uh, want to lose weight, and a lot of people want to get well, and they keep saying, "What should I do?" I'm not that disciplined. And I read somewhere that if you have a small kid, and do you spend time to discipline them? Yes, you do. You love them with discipline. No, you attend to all their needs, you do everything. Why? Because you love them. So it's time for the cancer patients to start loving themselves, because once you start loving yourself, you will form the discipline to follow a diet or to follow some plan, whatever protocol you decide for yourself. And don't expect that protocol to come from outside. Spend time, think intuitively. Your body is talking to you. It is telling you what hurts, where, what can you do, what you can't do. Don't try to force yourself to eat things that you don't like. So while you make a diet, make it something that you will love eating, right? It's not only medicine, it is food at the end of the day. So all these
Yeah.
messages, lot of messages.
This, but thank you so much for this. And in fact, I believe that, this would help so many, cancer patients and caregivers out there. And, the point that you highlighted to, that someone should take care of the caregiver as well. So it is very, very important point, because, everybody asks about the patient only, how are they doing, what all is going on, but nobody asks how is the caregiver doing. But like they are the one who's, taking care of the patient like each and every day. So, thank you so much for highlighting that point. And so, once again, first of all, I'd like to thank you so much for being in the cancer healing journey session today. And I'm sure that it will help so many people out there. And it was so much of inspiration, and I got so much of motivation from it. So, thank you so much, sir.
Thank you so much. Thanks for having me, and I look forward to the session. Thank you.
Yeah.